Hey guys, welcome to Medphonics Talks. I am Mohammed Unes, second year med student from Fergana Medical Institute of Public Health. Today I'm going to take you a world of anatomy. I'm going to teach you about anatomy. We are having a lot of to talk about anatomy. Now I'm going to start with general anatomy. So you can see that in my backside there is a blackboard writing a lot of things there. You can see these are the classifications of anatomy. So anatomy is a Greek word named anatom, and it is known as to cut, to study something. So we know that anatomy is a study of internal structures of the body, right? So there are having a many loads and loads of types of anatomy here. You can see cadaveric anatomy here. Cadaveric anatomy we will study with the help of cadavers. So we know that we are medical students, right? So we have to depend on like dead bodies or a corpse to study. So we used to cut their bodies and study the internal structures. These type of anatomies are called cadaveric anatomy. So next one is radiographic and imaging anatomy. These anatomies are according to the use with the help of, we are studying anatomy with the help of CT scans, MRI, X-rays, and these kind of imaging technologies. So you can see living anatomy here. Living anatomy, as the name tells, these are living anatomy. We will study with the help of living organisms. Then next one is comparative anatomy. Comparative anatomy, we will use a different type of species with another different type of species to compare them, and we are talking about anatomy. Like if I am comparing me with a bacteria, me with a monkey, these type of anatomies are called comparative anatomy. Next type of anatomy is embryology. Here we will study with the help of fetal development. We will study the development of the baby inside the mother's womb. Okay. Next is the genetics. As you all know that from the class 11 and 12, we are learning about the genetics. We are using genetical informations about these anatomy, like chromosome abnormalities, then Down syndrome, these kind of things. Next is histology. We are using tissues, cells, these type of studies, and we use microscopes like AIDS to study about these structures. So we will using microscope. Without microscope, histology is zero. Next is surface anatomy. We are studying with the help of the skin. So you know that we want to palpate a patient's artery or whatever it is. So we will study with the help of the skin, right? Under the skin there is artery. Then our veins are there, nerves are there. These type of anatomy are called surface anatomy. We are using skin. So this surface anatomy is also called as topographic anatomy. Next is experimental anatomy, like we are using experiments to do and study about the anatomy. Next is physical anthropology. We are using races or classes of people. If I am, I'm studying in Fergana and I'm in Uzbekistan, So if I comparing an Indian patient and comparing with the Uzbek patient, it is different characteristics. We are having skin colors are extremely different than each other, right? So the organs will be different. These kind of studies are coming under physical anthropology. Next is applied anatomy. So after studying all about this anatomy, we are going to apply it to somewhere. Like we are going to do a surgery, if we are going to see a patient, and we are applying all these kind of anatomy there. These type of anatomies are called applied anatomy. So now we are going to start about our next topic. Now next topic is positions. There are four main positions: anatomical position, supine position, prone position, and lithotomy position. These words are so new for you. This is anatomy. We are going to start new words day by day. Like I'm focusing on BD Chaurasia right now. So in BD Chaurasia, general anatomy textbook, we are having a 4th edition small book, right? So in that, they are only having four main positions there. If you want to study more about position, you should go through Google it, or you can study by Gray's Anatomy or any other kind of supplements you are using for your studies. So I'm going to talk about anatomical position right now. Anatomical position is a type of position the patient should standing in a like unnecessary way. Like it's not a normal like standing position as we are doing in our daily basis. It will be like the patient should, their eyes, we are focusing on the eyes right now. The eyes should be focusing on a point which is far away. Then the arms, this part is palm. The palm should facing the facial part. This is a palm face, so it is facing palms. Then the patient's feet should forward and they are looking straight, and these arms should be on the side of the body. So this position is anatomical position. Next position is supine position. This is a normal position as we are doing in our daily basis, like we are sleeping on the bed. The eyes should be looking towards the ceiling, then my lower back and every part of my body, which is the back posterior side, should be lying restingly. Okay, this is supine position. Next is prone position. Prone position, this position is face, right? If I am talking about the hand right now, it is a face and this is a back part. So this is pronation and this is supination. So if I am going to talk about the supine position, the patient should show this part of the hand. And if I am talking about the prone position, the patient should show this part. This is the prone position. So the same, they will be lying with their face, which is the back side, like they are sleeping with their chest, abdomen, genitals, and their legs, which is anterior, this front side. So the person who is seeing, they can see my back side. Okay, always remember that. Next is lithotomy position. This is a type of position which is only using in a particular situations, right? You have seen a lot of film, you have seen delivery scenes in the videos, right? So you can see that they are having like their legs are widened and some strap or something like that they have fixed with their legs and they are widening, which means that the doctor can see their genitalia and their upper genital part and lower genital part. This position is known as lithotomy position. So now we are going to talk about the planes. So first we talk about the subdivisions of anatomy, then we talk about the positions of anatomy. Now we are going to talk about the planes we are using in anatomy. There are basically four main anatomical planes: coronal plane, median or mid-sagittal plane, horizontal plane, and the sagittal plane. Then there are two special planes which is not commonly used always: oblique plane and cardinal plane. Cardinal plane. So now we're going to talk about the coronal plane. So in the coronal plane, suppose this is this portion, my arms, hand, this portion is going to cut my body, just think like that. So if I'm going to cut my body like this, which is dividing to anterior and the posterior side, which will be cutting like this side. So you can see my anterior and the posterior side. This plane is known as coronal plane. Next one is a median or mid-sagittal. Median means that middle, right? So mid-sagittal, just leave that name sagittal right now. Median, which is the mid portion. If I am cutting through the mid part of my body, you can take left and the right side very symmetrically. Okay, if I am going to cut my body, then you can see my left and right on the symmetrical way. Next is horizontal plane. Horizontal plane is also known as transverse plane, and this horizontal plane, if I'm going to cut this horizontal plane, you can see my upper and the lower part of the body. This plane are known as horizontal plane. Next is sagittal plane. You can see sagittal plane here. Sagittal plane is dividing just near to median plane. This is the median plane, right? This portion is median plane. If I am cutting here, this is sagittal plane. Sagittal plane will be dividing left and right, but they are not symmetrical. They are asymmetrical. This is asymmetrical and this will be symmetrical. Next one is oblique and cardinal plane. Oblique plane means that you have already learned the four planes here, right? Other than any four of them will be the oblique plane. Okay. Next is cardinal plane. Cardinal plane is a special plane in which the cardinal plane will be dividing the body very near to the center of the body. You know that this is my center of the body, right? It will be near to my body, which is cardinal plane. So you will ask, this cardinal plane and sagittal plane will be same. We will talk about that later more. So now we are going to start about the movements of the body, but before starting the movements of the body, I will be away from the screen right now. You can take a screenshot before I am starting the class. So now we're going to talk about the movements of the body, right? There are many movements in our body. Like it will be applicable to the upper limb, lower limb, like your back, neck, every parts of your body. First one is flexion. Flexion means that two flexure surfaces are together. Like I will teach you more about this later. But study just flexion will be like this. You can see my side view of my body. You can see this is a flexion. Okay, I'm keeping these two flexion surfaces together. This is flexion. And when I am extending my arms, this is known as extension. This is flexion and this is an extension. Next one is circumduction. Circumduction is a type of movement like we usually do in our childhood. We will when we are running, we will like what we are rotating our shoulder 180 degree, like 360 degree we are rotating. These kind of movements are known as circumduction. Next one is abduction and adduction. Don't feel confused that this is too much. There are so many. My body is very small, so I am keeping these markings here and there. Okay. Abduction and adduction. Abduction means that Abduction, leave there. We can talk about the adduction right now. You know that in your maths you have an addition, subtraction. Add means together, right? So adduction. Adduction means that if your arms are away, you are keeping the hand together to your body. See, this is adduction. And next one is abduction, which will be away from the body. If this is adduction, then this is a abduction. You are keeping your arms away from your body. This is adduction and abduction. Remember, add criteria. Next one is medial rotation, lateral rotation. Let it be there. We can talk about supination and pronation right now. Supination will be like this is a supine portion and this is a prone portion, right? We have already talked about the supine position and prone position. Same movements like supination and pronation. Like this is a supination and this is a pronation. My back side is a pronation and my front side is supination. Next one is inversion and eversion. We will talk about this later. Opposition. Opposition means that it is applicable to your thumb. You know that your thumb, right? Thumb is going to touch the other fingers. These are opposition. These are opposition. These are opposition of your fingers. Next one, we are going to talk about medial and lateral rotation. Lateral rotation and medial rotation. Just think that your hands are keeping to your body and it will be like a robot. Okay. If you are keeping your body together to your body, it means that your elbow will be in the same point. You are keeping your body, this hand, this portion to your abdomen. This is known as medial. This is lateral, which is away from your body. This is the lateral. So medial rotation and this is the lateral rotation. Next one is inversion and eversion. Inversion and eversion is applicable on your legs. This is our foot. So you can know that suppose this is my leg, this is my legs. If I am keeping like this and this, you can move your feet like that, right? Here and here. This is inversion and this is eversion. You can Google it more about that. So I hope you have understand this every moment right now. Flexion, extension, adduction, abduction, medial rotation, lateral rotation, circumduction, pronation, supination, opposition, inversion and eversion. Now we are going to talk about dorsiflexion and plantar flexion. What is dorsiflexion and plantar flexion? I have told if this is a foot, if this is your feet, this is inversion and this is eversion, right? So dorsiflexion, flexion means keeping some surfaces together. The same way we're keeping your feet part to your leg. Okay, if this is your feet and if this is a tibia and fibula, this part, then you are keeping your head like this. This is dorsiflexion, this is plantar flexion. Okay, these are dorsi and plantar flexion. So these are the flexions of your foot and this you want to study more than now. Okay, I hope you have understand others, but this dorsiflexion and plantar flexion and together with the inversion and eversion, you can study from your resources. Also, I will send you or I will put some photos or the figures of these movements in your body, like in the like end of the session, or I will put in the description box about this the type, the manner you can study more about that movements there. So now we are going to next to talk about the like systems in our anatomy. There are lots of systems. So now we are going to study about the systems of anatomy right now. If you're going to visit any hospitals nearby your town, you can see there are lots of departments, right? There are emergency medicine, cardiology, neurology. There are lots of departments there. These departments are actually divided according to the help of anatomy, and we are dividing the body parts and we are having specialty doctors there. You can see in my blackboard there are lots of departments here. There are only few now. I will talk about just basics now. Pulmonology. Pulmonology is a study of respiratory system. Okay, pulmonology is a study of respiratory system. It will only focus on the lungs, trachea, larynx, these kind of things. Next is arthrology, which is actually arthur or arthro means that joint. So study of joints is known as arthrology. Ology means a study of, you know that, right? Biology. Bio means living and ology means the study of body. Study of biology means that biology means study of living creatures. Like same arthrology means study of joints. Next one is myology, study of muscles and muscle attachment, everything. These kind of science like anatomical studies are known as myology. Next one is orthopedics, which we will focus on the bones. Actually, the arthrologists also focus on the orthopedics. They are the doctors of bones. They will focus on the bone, ligament, tendon, everything which is the relation to the bones. Next is angiology. Angiology is also known as cardiologists. They are focusing on the cardiovascular system like heart, arch of aorta, arteries, veins, everything, these kind of things. They are angiology. Next is gastroenterology. Gastro means that something dependent on the abdomen, right? Endro means inside. So, which is what associated with the esophagus, gastrointestinal system, small intestine. These kind of studies are gastroenterology. Next is urology. Urology are focusing on the urinary systems. Whether nephrologists are focusing on the nephron, which nephro means kidney. Urologists and nephrologists are different. Okay. Next is ENT. ENTs are focusing on the special senses like ear, nose, throat, these kind of things. Next is neurology, which is a study of the brain. This is a very vast science. We are also having neuroanatomy. There is a specialized field of studying brain. The next is dermatology, which we are studying and focusing on the skin diseases, everything. These are dermatologists. Next is andrology. Andrology and gynecology together, they are a reproductive science. Like we will focus on the male and female. Male, we are having sex organs like testes, prostate. These kind of organs are focused by andrology, and the gynecology, which is focusing on the female genitalia. That is gynecologist. Next is endocrinology. Endocrinology is a study of endocrine systems and endocrine glands, everything. These are endocrinology. So these are the basics, some of the parts or some of the systems of anatomy, and according to this you can focus more, and according to this after our MBBS life we will focus on our field of science, which we have to focus more. So I hope everyone like this video. I hope you all should watch the next video. Next video we will focusing on the bones and joints. Stay tuned. We will study more about anatomy next lecture.